Hi, my name is Layla and she's Nihrika. Today we're going to talk about kleptomania and amnesia.
And the overviews are the overview of kleptomania and definition, kleptomania and amnesia definitions. And we're gonna speak about the prevalence, how common it is, and then the symptoms of kleptomania and amnesia, causes and the treatment.
So we're going to start with kleptomania. We're going to the definition of kleptomania is the tendency to steal unneeded items that the person they can afford, but they just want to feel the rush out of it.
And the kleptomania prevalences are 6 per 1,000 people are suffering with kleptomania, and this is more common in women.
And the symptoms of kleptomania is that the inability to resist the urges that you feel when you want to steal the items that you don't need, and the feeling increased intention, anxiety, and arousal leading to the theft. And also another symptom is the feeling the pleasure and relief once you're done with the stealing, and also afterwards you feel some guilt, self-loathing and shame, and sometimes you feel the fear of getting caught after the lifting. And then the return of the urges comes back to you, which leads again to the tendency to shoplift.
And the causes of kleptomania. The causes are unknown, and several theories that suggest that the change is in the brain, maybe at the root of the kleptomania, and naturally occurring brain chemicals called serotonin. Serotonin regulates the feelings and emotions. It's like they tend to steal something and regulate to addictive disorders, and stealing may cause the release of dopamine. Dopamine is like they have the pleasure of feeling it's like they want to steal something. They have the tendency to go and steal something.
And the treatment of kleptomania, there's two types of treatment: the medication and the psychotherapy. Actually, for the medication, there's several types of medication, but there's no FDA-approved medication.
Thank you.
And the medication, and they use the medication for other diseases that accompany kleptomania. And they use antidepressant. Usually they use the SSRI, and also the opioid antagonist. It's an addiction disease which may reduce to the urges and pleasure associated with the stealing. And also the psychotherapy, it's a cognitive behavioral therapy, helps you to identify unhealthy negative beliefs and behavior and replace them with the healthy positive ones. And also these techniques include the covert I don't know why I can't pronounce words these days. It's covert sensitization, which you picture yourself stealing, and then you start picture others caught you. Then these urges might go away. And the other technique is the aversion therapy, which you use some painful techniques where you hold your breath when you have these urges, so it will go away. And the last one is the systematic, also desensitization, which you practice relaxation techniques and picture yourself controlling yourself during these urges.
And the next topic is amnesia. What amnesia exactly is? Amnesia refers to the loss of memory, such as facts, informations, and the experiences. This is due to the damage in the brain. And there are two types of amnesias. One is anterograde amnesia and retrograde amnesias. And anterograde amnesia is like when a person met with an accident. He will not remember things after the accident. He will not able to learn new things, new informations and all. And retrograde amnesia is like he will forget his past. He will not able to recollect everything which is which is before the accident. And instead, people with amnesia is also called as amnestic syndrome.
For the number of people in the US who has the amnesia, actually there is no prevalence shown because of the different types of amnesia. There's like more than 4 types, such as dissociative amnesia and transient global amnesia and more other types. That's why it's hard to have a number associated with it.
And symptoms of anterograde amnesia, the loss of the ability to form new long-term memory. They will not have the ability to learn new things. And next, people find themselves unable to remember the face of people name just a few minutes after hearing them. This is because this is due to the memory do not successfully transfer from the conscious long-term memory to the short-term memory. And retrograde amnesia is like the symptoms are incorrect way of language formation. They will not have a proper way. And the long-term memory loss, they have long-term memory loss, that is they will not have the ability to recollect everything. And the next is difficulty in recollecting the non-verbal information like facial expressions and gestures. And unplanned travel or wander from home or workplace.
And the causes of amnesia, usually there is a tumor formation in the brain, and there is a severe shock, stress, and emotional disorders. Also, the person who have a severe stroke that would lead to amnesia, and sometimes low-level oxygen that supply to the brain, they are fewer. That's why it causes amnesia. And also sometimes brain injuries such as car accidents and other injuries. And sometimes people who has infection would lead up to amnesia, and drug abuse, and there is like electroshock therapy, extreme alcohol abuse, and a lot more causes that lead up to amnesia.
And as a treatment, anterograde amnesia, they do not have a particular treatment for that. Social, and they should be someone behind them to tell them what to do in a daily life, because they will not remember the new things, they will forget everything. Within 5 or 6 minutes they forget everything. So there should be someone to let them know the daily routine. And retrograde amnesia, it's temporary, and it can be treated by exposing the patients to familiar objects, like showing something which is very known from the past.
And in conclusion, we're gonna repeat the definitions, which kleptomania is the urges a person has to shoplift minor items that they don't need and they can afford. Usually they return the item, just they want to feel the rush out of it. And the amnesia, this is a damage caused to the brain, and they do not have the ability to remember things afterwards.
And these are the differences for kleptomania and amnesia.
And if you have any question,
Thank you.
we'd be happy to answer.